Ever heard something that made you spill your tea, roll your eyes, or plain laugh out loud? Welcome to Say What Now TV, your place for daily content on tongue-slipping, mind-bending social issues and trending topics around the world. Be amazed, get annoyed, be entertained. Welcome to another episode of Say What Now TV. Jamaica continues to face a public health crisis which has now led to the downscaling of health services to emergency service only at all public hospitals across the island. The reduction in services came into effect on January 19, 2022. At present, the existing medical resources are unable to adequately cater to the health needs of the public. The rising number of confirmed cases, which now exceeds a daily average of 1,400 cases, is evidently overwhelming the healthcare system on the island. The inadequacies of the healthcare system is an age-old problem that is now magnified by the pandemic. The present condition of public health facilities with a growing number of hospitalized confirmed cases is a threat that cannot be ignored, and the temporary measure of reducing the availability of healthcare services, though timely, cannot be sustained over the long term. In recent months, a rising number of medical personnel have contracted the virus, which has directly impacted the healthcare sector. The doubling of efforts to contain the spread of the virus, treat infected persons, and carry out other medical duties within healthcare facilities has taken a toll on the already skeletal medical resources. The increased number of confirmed cases among medical staff poses a significant threat to the viability of services, as many remain out of commission during the recovery process. The psychological impacts of the pandemic on medical staff is also evident, and many express discomfort in working in high-risk environments where they are exposed to the virus on a daily basis. The escalation of crime across the island also poses a threat to the depleted healthcare system, with the murder toll inching closer to 100 in the first month of the new year. The sad reality is that persons seriously injured as a result of crime may succumb to their injuries due to a lack of available medical resources, including personnel. Close to 500 people lost their lives last year as a result of car accidents, and the projection for 2022 are on a similar path, with 23 people already killed in fatal car accidents since the start of the new year. Injuries from car accidents are at risk of becoming terminal if critical care in hospital is required, given the present scarcity of resources. Although the Minister of Health has reduced healthcare services to emergency care only, this does not mean the required resources are available to adequately serve the need for such emergency care. The medical resources in hospitals across the island is not evenly distributed, and some parishes lack resources more than others. The public health crisis on the island has caught the attention of international media, and countries like the United States of America recently warned its citizens against traveling to Jamaica due to the state of crime and the pandemic on the island. A ripple effect may soon be felt in other sectors as public health and safety continues to degrade at an alarming rate. Swift intervention is needed, possibly through regional and international support, to stave off the growing public health crisis. This may be hard to come by, as globally countries are faced with similar crises associated with the pandemic. Share your views in the comments below, and be sure to like, share, and subscribe. Also, check out another episode of Say What Now TV. Do you have a burning issue that would shock or entertain our viewers? Share your scoop at saywhatnowtv10@gmail.com.